Syringes. Rajiv Nath, Managing Director of Hindustan Syringes and Medical Devices, now joins us. Rajiv, good morning. Thank you for joining us. First, I want to understand from you, from the government and from other state governments so far, what has been your last communication and what is your preparedness in terms of availability and readiness whenever the vaccination process will start in India?
Hi, good morning. Well, yes, we've got an active ongoing dialogue with the Ministry of Health and the other government departments regarding the supply chain management of the syringes and the other drug delivery requirements for the COVID vaccines in play. And there are 3 manufacturers in the country. The government already had a huge stock of syringes from the UIP program. The syringes used are the same, auto-disable 0.5 ml syringes for the standard UIP program. Usually, conventionally, around 300 million injections are given every year. Typically, 6 months to 1 year inventory is always in stock. This time, we are told the inventory was higher because due to COVID, the government was not really implementing the vaccination programs between April and June. And even after June, it has been slow offtake. So they had already had a comfortable stock in place. They have placed additional orders with us for use for COVID and for non-COVID purposes. So for HMD, we have to supply 17.7 crore syringes by March, for which we have supplied 6 crores in December. We plan to supply 6 crores more in January and finish everything by March. Additionally, in the last week of December, they have taken out a tender of 35 crore pieces, which has been bid by the 3 companies. And what we are told is that the government is targeting that the 35 crore pieces have to be supplied by August this year. So now that the targets are well known to all of us, and the quantum is well known to all of us, we are all gearing up to meet the requirement and allocate our capacities accordingly. From HMD, we have increased our capacity from 560 million pieces per annum in June to 700 million pieces per annum in December. And this month, we hope to touch 800 million pieces per annum. And by April to June quarter, another 1,000 million pieces per annum. And by July to August, 1.2 billion pieces per annum. We had initially planned at a macro level to have 50% for India and 50% for the global requirement because probably we are the largest, if not the largest, the second largest manufacturer for these syringes worldwide, and one of the 4 leading suppliers to UNICEF and WHO and COVAX. So in December, we had also supplied in the last 5 months 16 crore pieces to COVAX WHO facility as their stockpiling for the COVID vaccines internationally. But considering the Government of India's ambitious targets to vaccinate 30 crore people by July, latest August, and their request to us. So we are considering to allocate around 60 to 65% of our capacity for the Government of India and the balance for the existing LTAs that we already have with UNICEF and WHO requirements internationally.
Syringe manufacturers are there in India, and what is your market share?
Well, our market share for disposable syringes would be more than 65%, but in the case of auto-disable syringes, it is quite mixed because this is tender-based. So historically, until say about 4 years back, we had about 70 to 80% of the tenders, but for the last 4 years, we get hardly 10% of the tenders because mostly the Chinese imports are being the L1, so they get at least 50%. And since the government asks us to match the non-remunerative Chinese pricing, which we refuse to do at times, and you have to maintain that low pricing for more than 2 years at a time. So then reluctantly, we pick up approximately 10%. So what we don't pick up goes back to the Chinese. So there's another Indian manufacturer who also gets some business. So 30% goes to him, 60% to China, and 10% comes to us in HMD. We are focusing mainly on the international export market. which is more, where we are globally competitive but more profitable for us.
Considering that entire COVID is going to be a global drive, you use the word UNICEF and WHO. How large do you think this could be as a business for Hindustan Syringe and the other syringe manufacturers? Because from India it will move to other countries, and then it will move to African and other poor nations. So this, perhaps the entire vaccination drive could be a 1.5 to a 2 year process.
Yes, very much so. But in disposable syringes, for example, in India, we've got around 28 manufacturers, and there's a huge surplus capacity. There's a glut in the market, both between the excess capacity between the Indian players as well as the low-cost imports coming in, especially from China, because of nil rate of duty or 7.5% duty in maximum cases. So with that, even the syringe manufacturers are importing components and importing needles, not making this internally. Now, internationally, the world's population, for example, is 8.5 billion, and around 10 billion injections will be required for COVID vaccination worldwide. The whole universe, I would say, could be divided globally in 3 segments. So you have the North and South of North America and Europe, which uses disposable syringes with a safety needle attached to that. That is as per the legislation requirements. So that's a different product specification, which is more expensive, made by those local manufacturers over there. Central Europe, Japan, the developed countries in the world, many parts of Middle East, many parts of South America, would be using standard disposable syringes for vaccination and for regular injections. And then you have got the developing world, like the Africa, South Asia, Southeast Asia, many parts of Central America, many parts of South America also, where there's a huge issue of syringes being reused. So because of the reuse issue, many years back, WHO had mandated the use of auto-disabled syringes, and there are about 25 companies listed with WHO PQS who have got their products listed with WHO to make such kind of syringes. So that becomes like a global, I would say, a pie that is available for the manufacturers, whether they are making for the market in India or they're making for the market abroad. Now, when COVID vaccine is going to be launched initially, it's going to be done by the government of India. So in the government of India, the requirement, like I mentioned to you, the tenders are already out, the orders have already been in place with us and with the other players for the auto-disabled syringes. But after April and May, it is expected that the vaccine manufacturers, the 2 leading ones plus the other people in the fray, they will also start supplying in the private market. And also the imports from Pfizer and Moderna will start coming into the private market. So in the private market, the Apollos and Maxis are expected to use either auto-disabled syringes or standard syringes. And from April, May onwards, when there will be wide availability of vaccines in the private market, then the existing manufacturers for disposable syringes, their standard syringes, would be used in the private healthcare, where the doctors and the clinics prefer to use the lower cost disposable syringes for their regular clinical practices. We had collated from our association that between the disposable syringe manufacturers, there is currently a spare capacity of 350 million syringes per month for disposable and auto-disabled syringes available. So we don't see any alarms or any issues that there will be shortages for syringes for vaccination.
All right. Thanks for joining us, Mr. Nath. You've really covered all aspects and given us a sense of really the kind of opportunity that lies here. Thanks so much, and also your preparedness for it. We're going to take a very quick break. When we come back, we'll also be joined by Mr. Velumani of Thyrocare.
Thank you.